there are a lot of responses, including some of my non-medical friends. Well, it's not relevant to me, really. Why do we need to go for it? You know, I'm very educated. I know I have no family history whatsoever. I think everything's going to be okay. Well, maybe you should consider some of these facts that we've just covered. 1 in 15 women in Singapore develops breast cancer. And we know that survival is best when cancer is in its early stages. We know that screening mammogram aims to detect disease in otherwise healthy people. So naturally, you would feel normal, but still, there is a good reason for why you should go for mammogram. And mammogram, to date, alongside ultrasound and MRI scans, it is still the only screening test that has been proved to reduce breast cancer mortality by more than 30%. And because of that, increases survival. So we advocate here that mammogram is your best defense against breast cancer because it can detect disease in a very early stage, the stage where it's still microcalcifications. Now, screening mammogram, what is it really? A mammogram is basically an X-ray images of the breast. And we have 2 sides, and it's done in 2 views each. So standard films, you will have 4 images in total. As you can see here, that your breast will be squeezed up and down, and then sideways. That's because we want to make sure that all the areas of breast tissues are covered. That's the standard 4 films that you will get. And then, what do we expect? You're going to be brought in front of a mammogram machine. You're going to be placed by a technician. You know, they're going to tell you where to place your arm, position your breast. They're going to ask you not to move as they lower the breastplate down to squeeze your breast. The compression is necessary, and at that time, you will feel some slight pain. If the discomfort is too great, you can tell the technician, and they will lighten up the load for you. But it is still very important to know that the compression will only last a couple of seconds as they ask you to take in a deep breath and hold, and they shut off an X-ray. It's like going around for a chest X-ray. You know, I think most of you have had a chest X-ray before. You just put your arm around something, they ask you to hold, and then a shot is taken. So similarly, they will do that with a mammogram. After that, after they're done with one view, they will then rotate the machine to take the other side of the breast. You need to let them know if you are expected or if you think you are pregnant, because although mammogram can be done when you're pregnant using an abdominal shield, as a screening, we also don't ask patients to come forward to have it done when you're pregnant. For very obvious reasons, your breasts are very large and engorged, and it's unlikely that we're going to be picking up anything at that time. But if you're pregnant and there is an abnormality, you can have mammogram done safely. You must remember that mammogram is just like a normal X-ray. There is no need for you to stop whatever drugs you're taking, and you can eat and drink normally on the day of the mammogram itself. Now, we always try to tell you not to put in any body powder or cream, only because these substances may interfere with the X-ray beams. Now, when you do a mammogram, I advise that you wear a 2-piece outfit because you will be asked to remove the top completely. So for your own ease of moving about, if you have 2-piece outfit, it would be good. People worry about radiation causing breast cancer, and as I have highlighted, the radiation dose that we require to induce cancer has to be more than 100 millisieverts in the terms of our radiation experts. Per mammogram, it's only 0.04. So the radiation dose that you use to treat a cancer can induce cancer in the breast. But if you go for a mammogram, that radiation dose will not lead to a development of breast cancer because of it. In some people, you feel very sore because your breast has been found to be so dense, they have to call you back for a repeated mammogram with an extra squeeze, what we call the magnified view. So instead of the 4-view mammogram, you may end up with several extras because they are trying to evaluate an area that is dense, and so they need to squeeze a little bit more. And if you feel sore, you can actually just take regular simple painkillers like paracetamol and aspirin. You should be able to resume your activities immediately after, and then when the result is out, you'll meet with a doctor to discuss. So currently in Singapore, the screening recommendation is as such. For women ages 40 and above, you are encouraged to consider to go on to have a mammogram from the age of 40 yearly. But when you are above the age of 50 to the 70s, you are actually invited. A letter will be sent to you to undergo screening mammogram once in 2 years. This is a national screening program. Other than mammogram, what else can we do? Oftentimes, when a mammogram is reported that the tissues are extremely dense, we also recommend that a person undergoes an ultrasound to evaluate for findings of these very small little cancers that will not be seen on a dense breast on imaging with the mammogram. I like this very much. No one is so brave that he is not disturbed by something unexpected, just like getting breast cancer or any other thing else. But, sometimes we always hear people say, I have this mass for 5 years, but it didn't hurt. And now, it's coming through the skin. Oh, why didn't you come earlier? I have no time. I'm so busy at work, And it's really sad, that we're so busy with work that we don't have time to find time to take care of ourselves. So I hope after you guys leave today that, many of you here would schedule yourself for a screening mammogram if you have not done so. If screening mammogram or an ultrasound finds something unusual or abnormal and you need to proceed on to have the tissues tested, what do we do? There are actually several techniques that we can do a biopsy. The first one is a fine needle aspiration, where it's like a blood-taking needle with a syringe. We unfrequently do this technique now because the cells that we get are sometimes inadequate to make a diagnosis. So we prefer to take core biopsies so that the tissue that comes out is in a longer strip. Sometimes we're not able to obtain any tissues without going to open surgery. I'll explain that in a little bit. So this is again a demonstration of a person undergoing needle aspiration. The needle is being placed under direct ultrasound guidance, and a couple of passes goes through just so that we can extract some cells. More performed commonly, we do this core biopsy technique where a machine slightly bigger than your usual needle and syringe size, it's being passed through a small cut on your skin that is about 2 to 3 millimeter wide into the lump. And under ultrasound guidance, you can see the needle going through it to take sections of the tissues that represent this mass for us to test. Sometimes the lesion is well seen, but it's small. And so even if the person undergoes a core biopsy, there is still a small chance that we may miss something or the tissues may not be adequate. In this scenario, we will recommend vacuum-assisted breast biopsy. The needle placement, instead of going through the lump, goes directly underneath the lump. A vacuum is being applied, and the needle comes out to cut, and the strips of tissues come out. If an abnormality is only detected clearly on MRI, you will undergo an MRI-guided biopsy, and you'll be in this position instead. Sometimes your calcifications that we find that are abnormal, but they're not clustered in one area. For example, in this case here, it's a wide area, and we're not sure if we sample this, will that then represent a cancer? If this is negative, can we be sure that this is not cancer? And if this one is negative, can we be sure this is not cancer? If we're not sure, sometimes the best way to do is to put in a wire to target the area and then undergo open surgery so that we can remove enough breast tissue for a definitive diagnosis. And so if the cancer is diagnosed, what now? Well, we will need to know the types of the cancer we're dealing with, because then the rest of the treatments that comes as a bundle when we deal with breast cancer, such as radiotherapy, chemotherapy, and the drugs that we take can be selected carefully. We also will stain make special stains on your tissue to see the genetic makeup of your type of tumor, to see what are the types of treatment you can receive other than surgery. And of course, we will need to do some scans to look for evidence of cancer elsewhere to see if it has spread. And if it has not spread, then surgery is usually the mainstay of treatment. Most of the time, patients are very afraid of going to surgery. You say, I don't want any cut on my breast. But to be honest with you, if you hear that you have breast cancer and surgery can be done for you, you should actually feel that you should know that this is still an early stage, it's confined to the breast, and we can aim for cure. Surgeries in the past, very commonly done, mastectomy. But in the past, not only do we remove the breast, we also remove the muscles underlying it. Nowadays, we know that there's no need to do that. So if you go for mastectomy, then it's just purely removal of the breast tissue. Your muscles is left intact. You'll end up with a flat chest. The other thing now that is currently the gold standard for